So welcome to this week's webinar. I'm Boj Zimar from Elite Benefits of America. We help small and mid-sized companies, even some large ones, with their employee benefit programs. We had created this Elite Benefit Playbook to help employers during the renewal process. For every year, it's an evergreen product that picks out points where we've had success, where we're able to lower costs. Now, this webinar is strictly based on a educational purposes only. Obviously, every case is going to be a little bit different. I do mention a case study in this webinar, and it may not be unique to your own situation. Your situation may be better or may not be as well as some other ones. What got us to this point where we created the Elite Benefits Playbook is these employers out there were having some issues with how to control costs, right? And so every year we're going through the same thing. We're shopping the same plans, we're moving the same carriers over and over again, and we're spreadsheeting and putting things side by side. And then a light bulb eventually went off. And there's a lot of things going on in our industry that help that, and we need to get access to more information, and we're going to walk through some of that, and we're going to talk about some of those conversations that should be having with employers if they're not already. The industry has really just taught itself how to buy health insurance at the renewal, and we just kind of take it for face value, and that's really about it. And so these employers, small, large, in between the medium-sized companies, are struggling with this, and the old school broker that our industry calls the status quo brokers are not really breaking free as much as they probably should. And so we created this playbook. We do have a scorecard after we go through this. If somebody wants to contact our office, we'll go through a scorecard. You're welcome to keep that scorecard. It's yours. You can take it back to your current broker, have a conversation with them, and be able to use it. And obviously, if we can assist in the process and move you into a better direction, we'd be happy to do so. So we're going to go ahead and start the webinar now and keep things moving. So what you're going to get out of this is more effective onboarding process, terminations with automation and payroll connections, and automate your benefits, right? It's just going to streamline the whole process. This is a part you're not going to see a direct impact on the bottom line. It'll be something that you're going to see over a period of time. It will save a ton of time and aggravation, as well as just time in general. It costs a lot of money to supply to HR, give them the tools and the resources, and then to have them spend 2 weeks of their entire year tracking down employee information to do an open enrollment, or even new hires, or even terminations for that matter. It creates an issue. So try to automate that process to make it a lot easier. Some of our payroll companies and vendors, not only ours, but in the industry, have really tried to streamline this, and that's fine. That's fine. They have their place too. But some don't like to integrate that well with the payroll company, because then it gives them more flexibility with payroll by moving payroll companies as they move along. In some ways, the payroll companies can become a little more of a commodity in some ways, so it gives them flexibility, but so is health insurance and perception. So I'm not trying to argue payroll, but anyhow, there's a lot of different tools that can be used, increasing better communications and engagement with your employees. And that's going to be key as time goes on, because you need to engage your employees. We've had enrollment processes that we've doubled, if not tripled, the amount of employees actually enrolled in the health plan. And that's been beneficial to the group, not only the premium wise, but like just more participation, more loyalty to the company. So there's a lot of return on equity for the company as well. Strategies to reverse the healthcare trend. And this is the biggest thing. Increases come in, broker may go back to the carrier and renegotiate, and then all of a sudden you get a little bit lower of an increase, but you still have an increase. But, how about, like just calling it a day and reverse the trend, but how do you control that cost, right? The biggest thing is I may save money, and this is another thing that occurs. You switch brokers, you find a new plan, new offer, and new broker, everything's fresh. Next year, you're right back in the same boat, right? That's why some agents and agencies are giving up a portion of their commission. They're just actually building a performance bonus in there, right? So you pay them additional money if they come back and your renewal is what they told you a year prior. And so there's a performance bonus. And I think a lot of people would reward that because of the way healthcare trends are going now. And if things come out better than what anticipated, probably should be some compensation behind that. But regardless of that, if your healthcare plan starting to reverse the trend, it actually goes back to the bottom line and you profit more and you can decide what you want to do with that. Employee incentives that are beyond wellness. Wellnesses are great, but they don't bend the curve, right? But we're talking about incentives to actually provide better health care to your employees and help lower costs. And then compliance. It's another passive thing that over time you'll have to address because these penalties could really come back and haunt you. So let's talk about this dreaded renewal. The dreaded renewal every year, it's literally like a fist fight, right? And so there's CFOs and owners and HR that really don't want to engage this. They kind of just want to get it done. And in fact, we've had situations where they only gave us 10 or 15 minutes for the renewal. And I tell you, it's not enough, right? If I presented an idea that was going to save you $100,000 a year, how much is that worth to you to spend more time than 15 minutes? Because you're not going to get a better rate of return on that money and that time unless you actually invest it. And so the industry has really taught us how to shop for insurance. And over the years, it just kind of compounded. So it's costing companies, employers, tons of money, and they have no leverage. And it seems like every year it's just going to be the constant hit of these renewals, right? And then you got negotiation tactics by brokers that go and they renegotiate, but especially on larger accounts, their commissions are tied to the premium. So are they really going to negotiate a better rate when their commissions have gone up? I don't know, right? I have integrity, and maybe that situation would be different for me as another broker, right? And so, but if it's tied to it, I'm not saying the broker or the consultant or advisor, whatever they want to call themselves, shouldn't be compensated for that. I'm just saying that that the incentives have to be aligned in that channel so that way your best needs are front and center, regardless of what the commissions are and how they're getting paid. So just a quick case study. We had a distribution company in the Midwest. They were limited based on the benefit spending that was going on. They couldn't grow and move to the next level. They needed more resources. They need more manpower. And so they needed to do something, right? They were handling the renewal the same way every single year. So there was always this constant spreadsheeting, negotiate, get a lower renewal. Fine, let's stick with it. Worry about it next year. And then next year is the same story. And it just this rat race, right? And finally, they got to the point where they had to lay off to maintain the benefits or find some type of change. They finally got desperate enough and said, okay, we need to find a different solution. So we were able to find it. And again, there's no magic wand. It's going to be resourceful brokers that are able to get access to these products. But but you need to have a playbook, right? And that's why we're creating this. So new solution for them led to $75,000 a year in first year savings, right? And so what is that going to do? The benefits were not jeopardized. The provider network was actually enhanced and made it better. In some cases, the employees actually had lower out of pocket than they had on the previous plan. And so plus, win, right? And then the employer got $75,000 back. And in this particular case, the employer actually took a good chunk of it and put it back into the premiums to lower their costs. So the employees actually save money next year, reduce their out-of-pocket expenses, more flexibility. So let's talk about data-driven renewals. This is one of the biggest issues when it comes to these renewals. On traditional plans that most of the people watching this webinar have been on for years, they don't show true numbers, right? The increase is 15%, but why, right? Medical trends in an area. But what does that mean for you? Why, like specific to your case? Just because, office supplies costs are going to go up, but what segment of the office supplies so you could actually handle it, right? And CFOs all over the country try to look at data all day long, and a lot of them actually overlook the health insurance. It's very confusing. It's we've been buying it a certain way for so many years, and all of a sudden, until you're desperate enough for your job in some cases that you finally look at the numbers and ask for it. In fact, there's more things coming down the pipe legally through laws that employers are going to have skin in the game and actually look at these true numbers, and insurance companies are supposed to provide it. Right now, if you called your current insurance company and you're not on a plan that provides monthly statements of where those expenses are going, then nobody knows what's going on, and the employer and the insurance company is not going to provide it to you. And so these reports really, it's data driven, right? So the CFO will look at this and they're going to be excited because now they could actually attack numbers, right? They could look at it and say, okay, why is this number so high? It looks high to me. And now you could ask more questions and say, okay, what can we do with this particular part of the data to make sure we can combat expenses and get it down? How can we control that situation? Whereas in this other area, we're actually doing really good. So let's reward that a little bit more. So that way the employees know that that's actually working. So how do you know that if you don't actually have the data? Most plans don't have it, right? And traditionally they never did. And so unless you move to different platforms, large companies probably have access to data. It's whether or not they're using the data correctly. That's the other issue. And so if you're not using the data when you're receiving the reports, shame on you. And the CFO of that company needs to be sitting at that renewal meeting, even though they feel like it's a waste of time, because they're the ones controlling the cost of that company. And if they're not looking at these numbers, they're not going to be able to control the costs. You're going to run the same problem every year, the renewal, and you're going to repeat the cycle every year. So, but just so you know, it's not your fault. It's not. And so, like, I'm not blaming you. It's the industry. It's us as brokers. Are historically for decades we've taught you how to purchase your own health insurance, and now all of a sudden now we have a problem. You're looking to seek advice, and that same broker's going, okay, well, I went back and negotiated with the carrier, and this is what they came up with, and I made a side by side spreadsheet comparing the rest of the market, but that's really all we did. And I think you're in a good spot, right? And so it's not your fault, right? You weren't challenged to look at data. You weren't challenged to look at something different until the premiums got too much, and you finally realized that maybe there's some people in your advisory committee that's not really doing what you think they should be doing, right? And even from the world of Butch Zemar, I always said, like, the rest of the world operates a certain way on our side of the business and on the retail end, which is when employers are purchasing health plans, distributing to their employees. Um, our industry is the only one that's different than everybody else, and the big question is why, right? So let's go back to what you knew. Use your common sense that you use in other areas and use it for your healthcare renewal. So, as I stated earlier, not all brokers are the same. So they could call them whatever they want. They could call themselves advisors and consultant. It doesn't mask the issue, right? Just because they call themselves something different and then they're not a broker, they're an advisor. That's what's on their card. They're an advisor. Well, that doesn't mean squat. I'm talking about results, right? So not all brokers are the same. And some of the brokers out there or insurance advisors don't have access to the same markets, and they either choose not to or they just can't, right? Some agencies are not willing. They just feel like everything is going to be the same. But part of it is because of incentives down the chain. There's retention bonuses and whatnot from the bigger carriers, and that becomes a financial incentive for brokers to not do much at all, just convince employers to stay where they're at. Plus, it's more work for the broker and the agency to switch carriers and all this stuff. But like, who is this all about, anyways? It's not about the broker, right? They're an advisor in a situation that has access to resources and reads the information on a regular basis that the employer doesn't have time to. So they're willing to outsource that knowledge base and pay for it. And traditionally, it's through premiums, and more so going forward, it's going to be separate consulting fees. And so therefore, you want advice. You want hard numbers to actually go by so you can make decisions on your employee benefit plan. So that's why we created the Elite Benefits Playbook. The Elite Benefits Playbook is put together, like most things, to win a game, to win strategy, you have to have a playbook and how you put that together. So let's talk about leveraging technology. Saves a bunch of time. We talked about this a little bit earlier. Communicating with employees. Engagement in employees being proactive, and you can make it automated, right? Make it better than it was before. You could send text messages, emails. There's so many different automation methods. A lot of times, if you just move the technology, it makes it easier. They can do it from their smartphone, right? You could make a kiosk in a lobby and allow them to log in and create an account, and you could walk them through it, and you're not collecting data and paperwork at midnight trying to put all this information in. You could minimize the time for follow up, right? You don't have to keep calling employees. There's actually automated follow up emails saying, hey, open enrollment's closing. Hey, open enrollment, you haven't completed your application yet. Hey, you got to get back in there, right? The timely responses of reminders really help. And instead of being on HR, you could automatically put it in place. This is the biggest component of the whole playbook, right? Everybody's after how do I lower my costs, right? It comes down to plan designs, how you control the costs. The reality of all this, right, is how you could control the expenses, right? So when you drive a company and you put revenue inside of a company, it'll go bankrupt if you can't control the expenses going out. It historically has been that way, and maybe the people listening to this have been in that spot. And so you have to have that under control, otherwise you can't do it. That's why we need data driven renewals. We need data. We need actually expense reports to show exactly where those numbers are going, so you could have something to go by. If you had a multi-million dollar claim, you could justify a 15-20% increase, maybe, but you could probably take it away from somewhere else and say, oh, hey, hold on here, look at this prescription drug over on this list. Why are we taking this prescription drug? And after a little bit of research, you find out that it's only $30 drug if you can find the generic, right? And it's made a lot of times by the same company. So instead of spending $1,500, you're spending $30. So you could actually customize the plan to eliminate the coverage for that one drug. And I'm not saying you shouldn't take coverage away from the employee, but if there's an alternative that's going to solve the exact need every single time, why would your health plan pay $1,500 to $2,000 versus 30 if it's available? And so you could take data and actually have some control over it. And just like anything else, right? You just can't just hemorrhage cash and pay these claims, right? And at some point, you could actually choose your vendors, and so you could choose who's handling the administration of the plan, who's going to be handling the insurance company, or the catastrophic insurance, who's going to control the pharmacy and where they're getting the pharmacy drugs and what those costs are and how they're handling the rebates. There's all this stuff that goes into it, and you're probably thinking, way too much detail. Well, the issue is going to come down to is whether or not you could afford that premium and that increase, or close your doors, right? That's what it's going to come down to. And then how do you control and manage a company and then grow and then have leverage and then provide an employee benefit package that creates loyalty inside of a company and higher productivity in the workplace. And that's where it really comes down to. So let's talk about employee incentives. You could actually eliminate a PPO network by providing the employees incentives or tools to lower their out of pocket, to not only go to a certain network, but actually lower the cost of the health plan. And so what's interesting about healthcare is that in most markets outside of health insurance, the higher you pay or the more money you pay, you usually get a better product, better outcomes, right? In the healthcare world, there's data that supports the idea that if you pay more for it, you have less of an outcome. It's just and Kaiser Foundation, I think, was one, and there were some other outfits where they correlated cost with the quality of care. So you could actually help your employees find the highest quality care and virtually eliminate or completely eliminate their out-of-pocket expenses to go there, because you as a health plan provider, as an employer, is going to pay less out of pocket for that plan, or I'm sorry, that claim, than you would if you allowed them to go anywhere they want inside of a PPO network. So you could virtually just eliminate the PPO network. It's really not actually adding a whole lot of cost to it, and then provide them the financial incentive to go to these provider networks, such as centers of influences, or there's outpatient surgical facilities that have better outcomes and recovery times and cost less. And then if they choose to go anywhere else, they just meet their plan deductible and out-of-pocket expenses, right? And so you're providing them an incentive to go. And then in some cases, like even doctor visits, you can eliminate their out-of-pocket. You can go to They call them direct primary care facilities that the employer puts in place and prepays a stipend for each one of the employees, and they go there as many times they want, and they'll be an advocate for their health. So if they actually do get diagnosed or need treatment for something, they will be by their side at no additional cost to the employee, especially when they actually need it the most. So the last thing is compliance issues. So compliance issues is one of those things that are passive. You probably could go years and never even have to worry about it, right? And so things are overlooked all the time, and they're not hitting on a timely manner. And so you definitely need to combat this, because all of a sudden you have a disgruntled employee, or you have a situation that comes up and there's an audit involved. You're going to have a situation where compliance is going to be big, and there's going to be penalties involved. And sure, you could probably negotiate, but these some of these fines, depending on what the area that you're violating or missing because you never thought about it, no one's ever pointed it out to you, all of a sudden you got a bigger issue than you thought, and it's going to cost you a lot of money. And so definitely something to look over and review on a regular basis. We do some of it in house, most of it we outsource, and we provide the tools and resources and the advisoryship as part of our team to make sure that the employers are on the right track and making sure that they get everything they need, whether it's related to HR or benefits compliance. So what if you don't do any of this, right? Status quo, you just keep going. I'll eat it this year. We'll raise our prices. We'll do maybe some other things. We'll increase revenue, hopefully, right? Like we're in this weird inflation time that maybe you won't be able to sell it for a higher cost, but you have other things eating that revenue up. There's a whole bunch of variables that come in, right? We've actually had doors that were shut because of the cost of healthcare, spouses that had to go back to work if they're the owner. We had employees that had to quit and move to another job because the benefit package you're offering as an employer wasn't to their level of expectation, for one. But two, it's costing them a ton of money. They could go over here, probably get paid more, and it costs them less out of their paycheck. So what are they going to do, right? You're going to create their own loyalty, or you're going to be stubborn? That's my question to you as you review your playbook. So, but you could have success, right? You could go down the avenue and have the data to make those decisions, right? Or have the data so you know what you're dealing with, right? And you could try to combat things in a different way. It's the same thing you would do with any other line item on the expense sheet of a business. You could have more predictable renewals. We could actually predict out based on historical data. Once you start getting into a playbook scenario, that you will be able to predict your renewals going forward based on past experiences. Sure, there's outliers and some other things, but we address those and we account for those. But you could manage these changes over time, right? It's a multi-year outlook. You may not qualify for any of this today, and that's okay, right? But you could do something about it today and step forward in the right direction. You no longer have to dread these renewals. You could do something better to move you in the right path. And so what do you get out of putting all this together, right? This whole playbook, right? You get a benefit administration portal that you may or may not have right now. Streamline the process, make things automated, right? So you don't tie up your HR department tracking down paperwork, setting up payroll, doing things manually. You put together cost containment strategies that you have a multi-year outlook and predictable renewals. Why not, right? Like, it makes things a lot easier in the workplace when you're trying to grow a company. You can manage those claims through employee incentives, where you can provide employees resources to lower their costs or eliminate them, at the same time give them higher quality of care. Compliance, uncover all the items due to compliance, so that way you don't have any unforeseen instances that will wipe out profits, wipe out employees because of situations, and you eventually will lose trust with some of those employees. So you could make sure you create loyalty and have things in the right spot. You'll always have ongoing support and consultation throughout the year with this playbook. Obviously, annually, and it varies by employer based on enrollments and how big the company is or how small the company, but all this can be valued over $150,000 a year. And so instead of paying for that, it's built into health plans. You might have to pay for some of it. It's like some of it's fee related, some of it's built into the premiums. It's really about how you put the square peg round hole and put it all together for your particular playbook. Every company is going to be a little bit different. So right now, the next step for you is to actually download a copy of the playbook. This will actually walk you through the items that we put here, and you can make your own notes on how you put it together. And you could download that at elitebenefits.net/playbook. The next thing you need to do is schedule a strategy call where we could actually produce a scorecard for you based on your current situation and where we need to go, so you could actually create that multi-year outlook. If for some reason at that point that you choose to just take the report and go on your own, that's fine. That's yours. We can go with it. If you want to engage the conversation, maybe propose some numbers, then we'll have an engagement letter that gets drawn up, and we can see how we can do business and move forward, and then move you in the right path. So you would schedule a call at elitebenefits.net playbook call, and then schedule an appointment based on your current schedule, and then we'll go ahead and schedule a meeting to make sure you get all the resources for your own particular playbook. Thanks for listening to this webinar. And if you need anything from us, go on and reach out. Thank you.